Hey Lab staff, and thank you for joining me in the final presentation of the Health and Safety Training Series for Return to School during the pandemic. This presentation is on personal protective equipment, which is a user's guide for safety in the school setting. The goal of this presentation is to educate school staff on when and how to appropriately use personal protective equipment in the school setting. The objectives for this training are to identify 4 different categories of PPE and their purposes, to recognize situations in which each type of PPE is needed, to determine when to change PPE and how to dispose of it, to describe the proper sequence for applying and removing PPE, and to demonstrate competency to utilize PPE in your individual programs. Just a brief review on the mode of transmission. I know we did discuss this in the initial training that we did. I just want to go over this really quickly. COVID-19 is a virus that is transmitted person to person via respiratory droplets, that's aerosolized respiratory fluids, oral and nasal secretions via speaking, coughing, sneezing, and direct contact with saliva between people in close contact with one another. Just a quick refresher that close contact does refer to proximity within 6 feet for at least 15 minutes. While the case was symptomatic or within 48 hours before onset of the disease, or direct physical contact with infectious secretions, that is being sneezed on, coughed on, direct contact with saliva while not wearing the appropriate personal protective equipment. So how are respiratory infections transmitted? This is a great visual to just kind of get an idea of exactly how it is transmitted from the infectious individual to the contact person. Again, it is that aerosolized droplet or infectious agent directly to the respiratory tract of the contact person in the event that they are not wearing the appropriate personal protective equipment, that surgical mask that they should be wearing. Saliva or nasal secretions coming in contact with an object and then coming into contact with the hands of the contact person, which then may come in contact with the mucous membranes of that contact person, the eyes, nose, or mouth, and then the saliva or nasal secretions on the hands of the sick person, then transmitting to the contact person. So a lot of variables here in terms of the transmission of the respiratory droplets from the infectious individual to the contact person. So how do we prevent transmission? The key here is wearing the appropriate personal protective equipment. PPE is equipment worn to minimize exposure to hazards that cause serious workplace injuries or illnesses. This is per OSHA in general, but for PPE for standard and droplet precautions, we are talking specifically about gowns, masks, which may be surgical, or N95K, N95, depending on the situation. Eye protection, goggles or face shields, again, depending on the situation, and gloves. So let's start first with the medical gown. This is used to protect the wearer from the spread of infection or illness if the wearer comes in contact with potentially infectious liquid or solid material. The medical gown is plastic, it's disposable, it is full coverage, it is fluid impermeable, and it is one size fits all with a waist tie in the back. As you can see, I am demonstrating the wearing of the medical gowns that we have ordered for the school year, and I am approximately 5'11", 6 feet, so it is almost entirely full coverage, coming down to the lower aspect of my shins, almost to my ankles, and these medical gowns actually do have thumb holes, which enable for extra coverage at the wrist, where the glove is able to come down over the wrist and create a full seal from glove to gown, which is an extra protective mechanism that we're really excited about. So medical gowns, when should you wear it? It should be worn for any activity in which prolonged physical contact is a requirement and there is a risk of exposure to respiratory fluids. So examples of when you might look to wear a medical gown is nursing interventions with a sick student. If you are engaging in feeding with a student, especially with G-tube feedings, certain therapy sessions such as PT or OT, or hands-on teaching and support that is one-to-one assistance, where you might have an extended prolonged physical contact and exposure to respiratory fluids. So if you're engaging in oral feeding of a student that is particularly has a lot of oral secretions, then you might look to wear that gown. The exception to wearing a medical gown when you otherwise might is behavioral interventions such as a restraint. And the rationale for this is that the gown material might be torn, which poses a choking hazard for student and also might be restrictive to the staff that's wearing the gown. So the recommended alternative is long sleeves and pants and a change of clothes for anyone who might need to engage in behavioral interventions during the school day. Frequently asked questions associated with medical gowns. Just want to go over these really quickly. How often should you change your medical gown? They should be changed daily. They are meant to be disposable. However, they are plastic. So in the event that they are, a student sneezes or coughs on you, you have visible fluids on them, you are able to clean and disinfect them, wipe them down while you're wearing them. But they should be changed daily at any time the gown becomes compromised. So in the event that it's torn, they're made of the fluid impermeable plastic, which can be cleaned and disinfected if visibly soiled while worn. But in the event that something happens to them, you are going to want to switch that out and move on to a brand new medical gown. Question, what if I'm participating in an activity where I have contact with multiple students at the same time? Ideally, you shouldn't have contact with more than one student at a time. If this is absolutely unavoidable, then you should wear the gown for the duration of the activity with that specific group and avoid touching students with the gown. Your gloved hands should be the primary point of contact in which you're able to change gloves between contact with students and clean and disinfect the gown after each activity. The gown physically should not be coming in contact with the students in the event that you absolutely have to have contact with multiple students at the same time. So how should I dispose of my gown? You should do so in the designated area into a disposal bin. Previously, this was recommended that it's a covered disposal bin, but that's no longer a requirement. Our PPE equipment is not considered to be hazardous material, so that can be disposed of into a regular trash bin. We do just recommend that you do so in the designated bins, whether it's directly inside your classroom or immediately outside. Follow with hand hygiene. And try to the best of your ability to avoid touching the external aspect of the gown, as that's considered to be contaminated. When I or another of our nurses goes over the donning and doffing demo with you in person, we'll be able to show you how to best avoid taking off the medical gown and touching those external contaminated aspects. So moving on to the surgical mask. This is used to create a physical barrier between the mouth and the nose of the wearer and potential contaminants in the immediate environment. The surgical mask helps to block large particle droplets that may contain germs, keeping it from reaching the wearer's mouth and nose. It also helps to reduce exposure of the wearer's saliva and respiratory secretions to others. So it's a dual process. It's helping to protect you, but also helping to protect others. The surgical masks that we will be using are 4-ply, disposable, fluid resistant, and have an adjustable nose wire, which helps to create a more smooth contact over the bridge of your nose and at your cheekbones to create a better seal. It's not a perfect all-around seal as you would expect with an N95 or KN95 mask, but the surgical masks do enable a very substantial protection against respiratory droplets. So when should you wear it? The surgical mask should be worn for all tasks that require close contact within 6 feet of other staff or students. So ADLs, whether that's feeding, dressing, toileting, changing, etc. Hands-on teaching support, one-to-one assistance, certain therapies, PT, OT, speech, behavioral interventions, and when using disinfectant sprays. This is an update from our previous training. You are going to want to use a surgical mask when using disinfectant sprays simply because that backsplash can cause respiratory irritation, and we did want to avoid that in our staff. Exceptions to using the surgical mask is assessment or treatment of sick students or staff, respiratory interventions, or any hands-on teaching support that's going to be required for students that are incapable of tolerating a mask. Obviously, that's something that we are trying to work on, but in the event that your student at this present time is incapable of wearing a mask, you are going to want the alternative, which is the N95 respirator. The rationale for this is that the surgical mask does not filter very small particles that may be transmitted by cough or sneeze and respiratory procedures, those aerosolized particles, which are high-risk situations. In these situations, you are going to want to wear the N95 or KN95 respirator. Frequently asked questions regarding the surgical mask. My student is wearing a cloth face covering. Why do I need to wear a surgical mask? Cloth face coverings help mitigate the spread of illness, but may not help protect the wearer from exposure. I feel like that's the key difference here in terms of the cloth face coverings versus surgical masks. So to effectively protect ourselves and our students, we do want to wear the surgical masks as best practice. Question, how often should I change my surgical mask? Ideally daily, and anytime the mask becomes compromised. So if it's visibly soiled, torn, or physically touched by a student, it is considered to be compromised, and you are going to want to change it. How should I dispose of my surgical mask? In the designated area, into that disposal bin, followed with hand hygiene. You want to avoid touching the external aspect of the mask, as this is considered to be contaminated. You want to remove the mask from the ear loops and then remove it from your face. You don't want to touch the actual 4-ply fabric of that mask when removing it. Do I have to wear a surgical mask? So per DESE guidelines, you need to wear a surgical mask in school within 6 feet of others. You could use a clear mask for teaching our student population when you are either 6 feet away from that student or in conjunction with a face shield. The clear masks are not considered to be interchangeable with the surgical masks per the fall guidelines. If you do have to be in close proximity, again, within 6 feet of a student for any extended period of time, which is considered to be 15 minutes or more, you're going to want to wear the clear mask with a face shield or the surgical mask. Question: I am unable to wear a mask due to a medical condition. What should I do? So you will be required to wear a face shield and maintain physical distance of at least 6 feet at all times. You will not be able to be within close proximity, again, less than 6 feet, of a student at any given time. So moving on to the clear masks, just a quick overview. They are used to create a transparent physical barrier between the mouth and nose of the wearer, similar to a face shield, but a more tight enclosed barrier, which enables the visualization of most of the face. This is particularly helpful as it improves access to communication. It enables visualization of cues and facial cues, lip reading, facial expressions and emotions, and it can reduce fear in young children. Imagine coming to school and young children are seeing everyone wearing a face mask. That can be difficult to process. So for many of our younger population, it may be beneficial to wear the clear mask if you're able to distance, or if you're wearing that face shield on top of it to enable a more close proximity. So when should you wear it? It's recommended for use by staff who are teaching, again, younger students. We're looking at the elementary population, and students who are hearing impaired and or rely on visual cues for communication. It is not recommended for high-risk situations in the event that you're working with somebody one-on-one that's unable to wear a face mask, in the event that you're working with somebody that is requiring a respiratory procedure at the time or may have COVID-19 symptoms, you're going to want to wear a higher level of PPE rather than the clear mask in this scenario. Frequently asked questions related to the clear mask. Can you reuse the clear mask? Absolutely. The clear mask is made of a similar material to the face shield and can be disinfected between uses. Question: how often should I change my clear mask? Replace the mask if compromised, example damaged. You should disinfect the outer aspect of the mask whenever visibly soiled between physical contact with students and at the end of each school day. Question: how should I dispose of the clear mask? Obviously, in the event that it's been compromised and you need to get rid of it, it should be disposed of in a designated area into the appropriate disposal bin, followed with hand hygiene. You don't want to touch the external aspect of that mask as it is considered to be contaminated. The clear masks, rather than being looped around the ears, do have double loops that go behind the head, one at the crown and one at the nape of the neck. So you are just going to want to take it off both straps over the top of the head rather than physically touching the clear aspect of that mask. So moving on to the N95 respirator, this creates a tight seal around the wearer's nose and mouth and meets the U.S. National Institute for Occupational Safety and Health, that is the NIOSH N95 classification of air filtration. These masks filter at least 95% of airborne particles. They are disposable, fluid resistant, have that adjustable nose wire at the bridge of the nose, and they are required to be fit tested to the wearer. So when should you wear one of these? This is a higher level facial mask that should be worn for high-risk activities that require close contact. That's within 6 feet of any individual suspected of having COVID-19 or a student receiving respiratory treatments. So any assessment or treatment of sick students and staff, any respiratory procedures such as suctioning or nebulizers, as well as any hands-on teaching and support of a student not wearing a mask. So if your student is physically incapable, they are not willing to tolerate wearing a mask at this present time, and you are required to be within their proximity, hands-on for over 15 minutes at a time, you should also be wearing that N95 respirator. And while it's not necessarily indicated here explicitly, anybody that is in the medical waiting area, whether it's a nurse or a staff member with a student, supervising a student that may or may not have COVID-19, they may just be exhibiting symptoms and we're dismissing them as a precaution, you should still be wearing that N95 respirator. So general precautions with the N95 respirator. People with chronic respiratory or cardiac conditions should check with their healthcare provider before using the N95 because the N95 can make it significantly more difficult for the wearer to breathe. N95 respirators are not indicated for children or adults with facial hair because the proper fit cannot be achieved. It really does have to create a full seal from bridge of the nose across the cheeks, under the jaw to the chin. You don't want any aeration to occur when you're wearing the mask. It really does have to be that full tight seal. Frequently asked questions associated with the N95. How do you fit test an N95? It's a great question. So per OSHA, we will be fit testing N95s using isoamyl acetate to fit test the N95s. It is a small ampule that we crush, and if you are not able to detect the scent of bananas while you're wearing your N95 or KN95 interchangeable when exposed to the isoamyl acetate, your N95 passes the fit test. So what if your N95 or KN95 fails the fit test? You can't wear it. We'll need to take measurements and procure special sizing for the N95 respirator for you. In the interim, you should wear a surgical mask and face shield. If you want to wear a failed N95 or KN95, it's certainly probably better than wearing a surgical mask, but it's not going to give you that 95% particle filtration that we would expect from the product. So it's up to you whether you're comfortable with utilizing the failed N95 or KN95. Obviously, we are going to work to find a product that works best for the fit of your face and find a product that will be fit tested and approved for you. But in the interim, if you want to wear that product, you're more than welcome to. How often should you change the N95 or KN95? So weekly, and anytime the mask becomes compromised, visibly soiled, torn, N95s and KN95s are approved for 5-day use maximum, which means you can use them from Monday through Friday, and we will look to replace that on a weekly basis. How should I store my N95 when not in use? So you want to keep the N95 respirator in a clean, breathable container, such as a paper bag, in between uses. You want to label that bag with your name and change the bag for each new N95. You don't want to use a Ziploc bag because a Ziploc bag is not a breathable container. It is isolating, which is going to just allow any bacteria or viruses that may be on the external aspect of that N95 or KN95 respirator to just essentially cycle and sit in that mask and then become accessible to the internal aspect. Whereas if it's in a breathable product like a paper bag, it's able to disperse and it's allowing that product to be usable for a longer period of time. So moving on to eye protection. It's used to provide protection from fluid entry into the eyes of the wearer. Our equipment options here are safety goggles and face shields. They are both reusable and they are both fluid impermeable. Safety goggles are used to protect the eyes, eye sockets, and facial area immediately surrounding the eyes by performing a protective seal around the eyes, preventing objects or liquids from entering under or around the goggles. These are the primary protectors, meaning that they are preferred in terms of high-risk situations for exposure to respiratory droplets. The advantage to wearing safety goggles is that they are the most reliable eye protection from splashes, sprays, and respiratory droplets because they are enclosed from forehead to the under aspect of your eyes. Whereas the disadvantage is they don't provide splash or spray protection to other parts of your face. The face shield, as modeled by Paulo Rizzo here, is used to protect the eyes and face against fluid splashes or sprays. They're considered to be secondary protectors simply because they don't offer that full seal around the eye socket. The advantage to wearing the face shield is that it provides a barrier to acutely expelled aerosols of body fluid, protecting a larger portion of the face. The disadvantage is, of course, that there's no peripheral facial seal. So face shield versus safety goggles, how would you select the best option for the situation when to wear it? The face shield is recommended for any activity in which prolonged physical contact is required and there's a risk of exposure to respiratory fluids. So we're looking at situations such as nursing interventions, feeding, certain therapies like PT or OT, behavioral interventions, in conjunction with a clear mask if it's indicated, obviously if you're within 6 feet of that person, or when using disinfectant sprays. Goggles should be worn for high-risk activities that require close contact, again, within that 6 feet radius, of any individual suspected of having COVID-19 or a student receiving respiratory treatments. So we're looking at situations to wear goggles for those who are administering treatment of sick individuals or staff, respiratory interventions, or any individuals who are doing hands-on teaching support for students not wearing a mask. So for our one-to-one staff that might be working with a student who's not capable of wearing a mask, if you're wearing that N95, you're also wearing goggles. Note that a face shield and goggles can be used together for high-risk situations. So in the event that you're more comfortable in a high-risk situation, wearing a set of goggles and a face shield on top, you can do so. Frequently asked questions for eye protection. Do glasses or contact lenses count as protection? So no, these items are not considered to be PPE and do not protect the eyes from droplets. Please wear the applicable eye protection over your prescription lenses. So obviously I am wearing glasses currently. I would need to wear a face shield on top of that in applicable situations, or potentially goggles on top of my glasses. The goggles will fit over your glasses and create a full seal over the forehead and underneath the the socket of your eyes. Question, are we sharing eye protection between staff? No. So staff who need to use eye protection will have their own equipment. We ask that you please label your equipment with your name and store it in a secure place. We are going to provide drawstring bags for each staff member to be able to store your reusable PPE equipment in a secure place. You can put your name on that bag. That bag is yours to keep, and that way you can just have it in a secure place and transport it wherever you need to go. Question, how often should I disinfect my goggles or face shield? So you should disinfect the outer aspect of the goggles or face shield that's considered to be the contaminated surface between physical contact with students. For example, students have touched it, whenever visibly soiled, and at the end of the school day. So if nobody has come into contact with it, I would still clean it on the outside just to have that security, and you're done for the end of the day. Question, how should I dispose of my goggles or face shield? So your eye protection is reusable. You shouldn't dispose of these items unless they're compromised, if they're damaged, if they're broken, if your face shield has a tear or is no longer able to be secured around your head, if your goggles have some damage to the elastic that is secured around your head, then you would need to replace that. Otherwise, they are fully reusable for an indefinite period of time. Moving on to gloves, these are used to create a physical barrier between chemical and body fluids in the hands of the wearer. It helps prevent the spread of germs. These are single-use disposable. Typically, they come in two standard sizes of medium and large. They do fit most people, but obviously all of our hands are different. So small and extra large sizes are available upon request. We prefer to use nitrile or vinyl gloves in these scenarios. We are not going to use latex simply because there is such a high risk of allergy to latex in many of our settings. So we will always use nitrile or vinyl. So when should you wear gloves? Gloves should be used for any activity in which there is prolonged physical contact, and there's also a risk of exposure to body fluids, bodily tissues, mucous membranes, or broken skin. So we're looking at situations such as nursing assessment and interventions, feeding, including G-tube feeds, toileting or changing a student, other ADLs such as toothbrushing, face washing, any ADL where you might come into contact with a mucous membrane, again, eyes, nose, mouth. Certain therapies such as PT or OT, behavioral interventions, and gloves should also be worn when using disinfectants such as chemical sprays or Sani wipes, and handling a reused N95 respirator. Additional considerations for gloves are that wearing gloves are not a substitute for hand washing. You always want to wash hands between contact with others to prevent cross-contamination. Frequently asked questions regarding gloves. Question, how often should I change pairs of gloves? Whenever gloves are visibly soiled, compromised, for example, torn, for applicable activities, and between contact with students to prevent cross-contamination. So one example is if you're donning gloves to feed student A, then you dispose of your gloves, don a brand new pair of gloves to change student B in the bathroom, and then dispose of that set of gloves. When in doubt, change your gloves. Question, do I need to wear gloves if I'm not in close contact with students or staff? No. For non-contact and non-applicable activities, gloves are not needed. Hand washing is the #1 defense against the spread of infectious disease. So you're just going to want to wash your hands, whether that's with soap and water, which is preferred, or with hand sanitizer between contact with students or surfaces. Question, how should I dispose of my gloves? In the designated area, into the disposal bin, follow with hand hygiene. Avoid touching that external aspect of the gloves, as this is considered to be contaminated. So just an overview of PPE needs by activity. This is a great visual. I will have this available in every classroom just so you can see exactly what you should be wearing based on the given activity. So for teaching and support, that where you're able to be 6 feet away, you're only wearing that surgical mask or clear mask, whatever is your comfort. Teaching support hands-on, where the student is wearing a mask. You might be wearing a gown in that situation. It sort of depends on whether that student has a baseline high frequency of a lot of nasal or mucosal discharge, a lot of drooling, that sort of thing. You would be wearing gloves, a face shield, and the surgical mask or clear mask. Teaching support hands-on, where the student is not wearing a mask. Again, you might be wearing the gown in that situation, depending on your student population. You would be wearing gloves, and I would highly recommend wearing goggles and the N95 in that situation, simply because they're not wearing the mask, so you don't have that added layer of protection. For feeding a student, whether it's oral or by G-tube, you're going to want to wear a gown, gloves, face shield, and surgical mask or clear mask, whatever your comfort in that situation or whatever the student needs. Obviously, if they are hearing impaired and they might have difficulty understanding you while you're communicating with them in that scenario, the clear mask might be preferred. Toileting or changing a student, you're going to want to wear gloves, a face shield if there is that high risk of respiratory secretions, or also a surgical mask or clear mask, depending on the situation or the student population. Behavioral interventions, you should be wearing gloves, goggles, and the clear or surgical mask. Physical therapy, we recommend wearing the gown, gloves, face shield, and clear or surgical mask. For nursing interventions involving a healthy student, so an injury, your scheduled student medications or treatments, we would recommend wearing gloves, a face shield, and a surgical or clear mask. However, if you are involved in nursing interventions with a student that is experiencing symptoms of illness, whether that's COVID-19 related or otherwise, we are recommending gown, gloves, face shield if appropriate for the situation, but also goggles and an N95 respirator. And of course, any respiratory treatments in which you're expecting aerosol generation, then we are recommending the full PPE. So gown, gloves, face shield if appropriate, but certainly goggles and N95 respirator. So just an overview of donning and doffing. What exactly does that mean? Donning refers to the act of putting on your personal protective equipment gear. Donning must always be performed in an area where it's safe to be without PPE, and all items must be worn prior to entering the area which the applicable activity will take place. So you certainly don't want to be within 6 feet proximity to a student without wearing the appropriate PPE gear. Doffing refers to the act of taking off PPE. It must always be performed in a designated area to prevent cross-contamination. All items, with the exception of the face mask and eye protection, should be removed in a designated area within the room where the activity took place, and the mask should be changed only if compromised. So what is the donning sequence, the procedure for putting on personal protective equipment? First, you want to perform your hand hygiene, washing your hands or using hand sanitizer. You're going to put on the medical gown. Then you're going to put on the face mask or respirator, whichever is appropriate for the situation. You're going to put on your eye protection, which may be your face shield or goggles, depending on the situation. You're going to put on your gloves, and then you're going to enter the area where the applicable activity for the PPE needs will take place. The sequence of PPE donning may vary depending on what PPE is needed for the specific activity or situation. So this sequence, again, may be a little bit different depending on what you need. So apologies for the delay here. This is the demonstration video on how to safely put on personal protective equipment. So for the sequence for putting on PPE, it will vary depending on the gear that's needed for the specific activity or situation. So for example, if you're teaching students at a distance, you're going to want to engage in hand hygiene and then put on that clear mask if that's appropriate for you in that given situation. If you're toileting or changing a student, you might then first engage in hand hygiene, don that surgical mask if you're not already wearing one, and then don gloves. If you are feeding a student, whether that's oral or G-tube, you might engage in hand hygiene, then don a gown, don that surgical mask if you're not already wearing one, don a face shield, and then don gloves. For nursing assessment or treatment of sick students or staff members, you're going to want to engage in hand hygiene, don a gown, don the N95 respirator, don goggles, don a face shield if applicable, and don gloves. And just to note that the surgical mask only needs to be applied if you're not already wearing one. The doffing sequence, which is the procedure for taking off your personal protective equipment, is to first remove your gloves and dispose, remove your gown and dispose, exit the area where the applicable activity took place, so potentially leaving the classroom, perform hand hygiene, remove your eye protection and disinfect as it is reusable, remove your respirator or face mask if it's compromised, and perform hand hygiene once again. Your final step is to apply a new face mask if applicable, or don PPE appropriate for the next activity. Again, if your surgical mask is not compromised, you can continue to wear that for the duration of the remainder of the school day if you don't need to apply a higher level personal protective equipment to engage in the next activity. So we're going to go ahead and watch the video for how to doff or remove personal protective equipment per the CDC. So once again, just as we do for putting on PPE, the sequence for taking off PPE may vary depending on which gear is needed for the specific activity or situation. So in the event that you're able to teach students at a distance, if you're taking off your clear mask to transition to a surgical mask or the approved cloth mask, you are then going to engage in hand hygiene at the end of the day, or if your mask is compromised. If toileting or changing a student, you're going to remove your gloves, engage in hand hygiene, remove that surgical mask, again, only if it's compromised or if you're switching to a different type of face masks, and engage in hand hygiene once again. If you're feeding a student, whether it's oral or by G-tube, you're going to want to remove your gloves, then your gown, engage in hand hygiene, remove your face shield, then your surgical mask if compromised or switching to a different type of face mask, and engage in hand hygiene once again. If you are performing a nursing assessment or treatment for sick students or staff members, you're going to want to remove your gloves, then your gown, perform hand hygiene, remove your face shield and goggles if both are indicated for the situation, remove your N95, and then engage in hand hygiene once again. A reminder that the surgical mask only needs to be removed if it is compromised or if you're switching to a different type of mask. Frequently asked questions for donning and doffing. So question, if my surgical mask is uncompromised, example, intact, no visible soiling, untouched by students, how does that affect the PPE donning sequence for the next activity? So the answer is you want to proceed with the donning procedure for the PPE needed during the next activity, omitting the step for putting on the mask since you're already wearing it. However, if a different type of mask is needed for that next step, like an N95 or a clear mask, you should dispose of the surgical mask prior to beginning the PPE donning sequence. So one example of this might be if your first task is feeding a student and your second task is toileting, the doffing PPE from the first task might be removing the gloves, then the gown, you're performing hand hygiene, removing that face shield, and hand hygiene again. You're not removing the face mask because you can use it for the next activity. And then the donning PPE sequence for the second task is simply performing hand hygiene and putting on a new set of gloves. Whereas if your first task is toileting a student and your second task might be teaching a group, the doffing PPE sequence from the first task is to remove your gloves, perform your hand hygiene, might be to remove your surgical mask if appropriate for the situation, and perform hand hygiene again. And your donning PPE for the second task might be that you're performing hand hygiene and putting on that clear mask as teaching that group, might be whether it's an elementary group of students or students that are hearing impaired or require the physical visualization of facial cues to be able to communicate. You might be wearing the clear mask instead of that surgical mask. So that's just two examples of the sequence that might occur, but again, it's totally dependent on the situation. So this concludes our personal protective equipment presentation. Congratulations, guys. This is the longest presentation that I had to give to you, so you made it through. The next steps are the competency assessment, which is the PPE presentation post-test, as well as an in-person skills demonstration. So together, you and I or one of our other nurses are going to do the demo for putting on and taking off PPE. And you're also going to have the opportunity to engage with us in whatever questions that you might have specific to PPE, your student-specific inquiries, your classroom-specific inquiries, all that kind of stuff. And then the second piece, again, is consultation with the nursing department. What are your PPEs for your specific classroom or discipline? These will be completed via the PPE request form that we have. Again, it's a compilation of PPE supplies as well as the cleaning and disinfecting supplies that you might need from the previous presentation. So all of those requests specific to your individual classroom or department can be requested on that form. You'll also be able to have the opportunity to consult with us regarding your student-specific or classroom-specific concerns. If there are certain personal protective equipment that you might need based on your student population, some additional PPE levels that you would like to discuss, any questions or concerns that you might have, please feel free to discuss that with us at that time. Again, as always, you're more than welcome to reach out to me via phone or email with any questions or concerns regarding the content that we've discussed today, or any questions regarding your personal classroom, your student population, any student-specific concerns, anything that you want to troubleshoot with the nursing department, you are more than welcome to contact me for. Thank you guys again for tuning into this entire presentation series. I know it's a lot of information to absorb, but all of these protocols, policies, and procedures, all of these changes, it's a totally, completely new mindset that we're all adopting in order to ensure the health and safety of our entire lab community moving forward into the new school year. So I really appreciate you guys taking the time to tease through all of this with me, and I am so grateful for all of your attention and questions and any ideas or suggestions that you guys might have moving forward. I am absolutely open to anything that you guys want to discuss. So again, feel free to reach out to me, and I look forward to seeing you in person over the next couple of days.